go.
All right, the next test we're going to do is an overhead deep squat. This is an easy way to look at someone's lat flexibility, shoulder mobility, thoracic mobility, kind of all in one test. So how we run them through this is you have the golfer put the club straight above their head, and then there's a few things we're looking for on this one now. So they want to try to keep their hands above their footprint during this entire squat, and you also need the heels to stay down on the floor. Knees stay forward, so when they squat, they can't actually rotate to compensate, and the knees should stay pointed forward the whole time, and the femur should be parallel to the ground or greater. Okay, so go ahead and try it with her. Okay, so for her, you can see we're not quite parallel, so come on back up, and the hands do have to drift forward. So if they fail that test, I'll take the club here. Have the golfer put hands behind their head. Okay. And then try the deep squat again. Okay, so a little bit better. Come on back up. What that looks at is if they have lat flexibility issues or glenohumeral issues, when you take the hands down and they pass that the overhead deep or the deep squat, then that points to shoulder mobility issue, lat flexibility issue. So with her, still couldn't get into a full deep squat. So then what we'll do is add something underneath her heels. Okay, so you just prop your heels up there. Okay, hands here. Okay, and then overhead deep squat again. Yep. Okay, so there's a path. So that points for her, most likely, you can come on back up, that it's an ankle mobility issue. As soon as we put her in a little bit of plantar flexion, then she went right into her deep squat. So maybe not as specific to the shoulder, but still an easy progression to kind of go through your deep squat and try to figure out where their limitations are. That's overhead deep squat.